So this is the mid-sagittal female pelvis model. When you're looking at this, this is superior, this is inferior, this is anterior, this is posterior. So if we're looking at the yellow adipose tissue right here, this is called the mons pubis. This is the little fat pad that sits in the anterior aspect of her pubic region, usually covered by pubic hair. Whenever we go down here, this is the labia majora because it's bigger, labia minora because it's smaller. All of these structures you can see from the external view, as well as the clitoris, which is right here. Now, if we go internal, whenever we look at this little canal right here, this is the urethra. So this attaches to the bladder. This is how she can actually urinate. So this would be called the urethral orifice, where the urine is going to come out. If we go back a little bit to the posterior, this is the vagina. This is the vaginal canal, so this would be the vaginal orifice. So this is where the penetration would actually occur during intercourse. These muscles here are called rugae. They allow for expansion of the vagina. And then as we go up, the part of the uterus that meets up with the vagina is called the cervix. This is actually the area where they will do a pap smear. So when females get a pap smear, this is where they are taking cells from off of the cervix to make sure that everything is normal. Whenever you're looking at the uterus itself, this is divided into 3 sections. So the inferior most section is the cervix. The majority of the uterus is called the body. And then the rounded superior section is the fundus. So we have 3 parts to the uterus, but we also have 3 layers to the uterus. So in layers, the endometrium is the innermost layer. Then we have the myometrium, which is the muscular layer. And then we have the perimetrium, which is the outer layer. The endometrium is the layer that sheds whenever she has her menstrual cycle. The myometrium, because this is the muscular layer, this is the one that will either give her cramps during her cycle or the one that will help push the baby out during childbirth. Okay, so endo, myo, perimetrium are the 3 layers of the uterus, as opposed to the 3 sections, which would be cervix, body, fundus. As we come more posterior, you can see that this is the rectum. You have sphincters here to help keep your bowels in and under control. Whenever it is time to have a bowel movement, then obviously it's going to come out here, out of the anus. If we go a little bit deeper, you can see here as we move inside of the pelvic cavity, this is the round ligament. And you can see that this is the fallopian tube that is going to be attached to the uterus that comes around towards the ovary. Now, this fallopian tube does not actually touch the ovary in real life. So even though it looks like it in this model, just don't get that confused because they don't actually have direct connection between the fallopian tube and the ovary.